The facts on omega-3 essential fatty acids: health benefits, side effects. 12 health benefits of omega-3 fatty acids: heart disease, blood pressure, blood fat, triglycerides, depression and anxiety, ADHD, asthma, Alzheimer's disease and dementia, eye health, bone and joint, inflammation, improved sleep, skin health. 7 side effects of omega-3 fatty acid: high blood sugar, bleeding, vitamin A toxicity, insomnia, gastrointestinal trouble, rash, bad taste or smell. Omega-3 fatty acids are well known for their many health benefits. Fish oil is gaining popularity as a dietary supplement due to the positive impact it has on cardiovascular health and immunological function, among other purported advantages. However, there is much debate about whether it actually helps and has a positive effect on health. This chapter looks at the research on omega-3 fatty acids and weighs the pros and cons of consuming them. And before we start, smash that subscribe button for more videos like this in the future. Unsaturated fatty acids with double bonds are called omega-3 fatty acids. Alpha-linolenic acid, ALA, eicosapentaenoic acid, EPA, and docosahexaenoic acid, DHA, are among examples. ALA. Polyunsaturated fats, such as omega-3 fatty acids, have been linked to a number of health benefits. Oily fish like salmon, mackerel, and sardines are good sources of the 2 essential omega-3 fatty acids, DHA and EPA. Flax seeds, pecans, hazelnuts, and walnuts are rich in ALA, which is converted to DHA and EPA in the body, making them a good alternative if you don't eat fish. Omega-3 fatty acids are essential nutrients you can find in your diet, or in supplement form, and help your body function normally. Each and every cell wall is required for proper formation. They provide energy and help the heart, lungs, blood vessels and immune system work efficiently. Omega-3s are essential nutrients in the same vein as vitamins because our bodies cannot make them. These fatty acids are essential for the proper functioning of the body and provide several health benefits. However, more omega-3 fish oil is not always better, and overuse can be really detrimental. Let's go over the advantages and disadvantages one by one. 1. 12 health benefits of omega-3 fatty acids. 1. Heart disease. Heart disease is the leading cause of death worldwide. Omega-3 fatty acids have been shown to improve key markers of heart health and reduce the risk of developing cardiovascular disease. However, with few definitive studies, the impact may be minimal. A meta-analysis of 17 studies published in 2011 found that people who ate seafood, fish and shellfish, 3 to 4 times a week had a reduced risk of death from cardiovascular disease. As of 2018, there was no indication that omega-3s could reduce the incidence of fatal or non-fatal coronary heart disease, according to a meta-analysis of 10 large omega-3 supplementation studies, 77,917 total participants, all at high risk of heart disease. 2. Blood pressure. Fish oil may reduce blood pressure by increasing the availability of nitric oxide and relaxing smooth muscle. Omega-3 fatty acids can help those with high blood pressure. A review of clinical trials indicated that consuming the omega-3 fatty acids EPA and DHA, which are present in oily fish such as salmon, cod, sardines, and canned light tuna, or taking omega-3 supplements can lower blood pressure. They are thought to assist blood vessels dilate, lessening the need for the heart to pump blood as forcefully throughout the body. This could explain why they have a lower risk of heart disease. Although it is useless in persons with normal blood pressure, it may help people with high blood pressure. 3. Blood fat, triglycerides. It is normal for your liver to have some fat on it. A fatty liver occurs when fat accounts for more than 5% of your liver. Non-alcoholic fatty liver disease, NAFLD, affects people who drink little or no alcohol. High body weight, insulin resistance, high blood sugar, and high blood fat levels are all possible causes. Fish oil reduces fasting triglycerides via reducing the liver's production of triglyceride-rich VLDL. It also reduces post-meal triglycerides by boosting the rate at which triglyceride-rich chylomicrons are removed. Fish oil, comprising EPA and DHA, is a gold standard for decreasing triglycerides, consistently lowering them by 15 to 30%. People with higher baseline triglycerides had greater decreases. 4. Depression and anxiety. Depression is one of the most common mental illnesses in the world. Symptoms include sadness, exhaustion, and a general loss of interest in life. Another common condition is anxiety, which is characterized by persistent worry and distress. Surprisingly, studies reveal that people who consume omega-3s on a daily basis have a lower risk of depression. Furthermore, when people who are depressed or anxious start taking omega-3 supplements, their symptoms improve. There are 3 forms of omega-3 fatty acids: ALA, EPA, and DHA. EPA appears to be the most beneficial of the 3 against depression. According to one study, EPA is as effective as a standard antidepressant prescription in treating depression. 5. ADHD. Inattention, hyperactivity, and impulsivity are hallmarks of attention deficit hyperactivity disorder, ADHD. Several studies have indicated that children with ADHD had lower blood levels of omega-3 fatty acids than their healthy peers. Furthermore, numerous studies demonstrate that omega-3 supplementation can help reduce ADHD symptoms. According to some research, fish oil can help certain children with ADHD by reducing symptoms and enhancing brain processes including thinking, remembering, and learning. More study in this area is needed, and omega-3 supplements should not be utilized as a main treatment. 6. Asthma. Asthma, according to the National Heart, Lung, and Blood Institute, NLB, is a long-term or chronic illness that causes the airways in the lungs to occasionally enlarge, become irritated, and narrow. Asthma symptoms include coughing, chest tightness, shortness of breath, and wheezing. They are caused by swelling and inflammation in the airways of your lungs. According to a 2019 study, persons with fully or partially controlled asthma had higher blood levels of the omega-3 index, percent of EPA plus percent of DHA. A lower use of an inhaler was also associated with a higher omega-3 index. According to the study's findings, having a higher omega-3 index is associated with better asthma control and a lower ICS dose, meaning that having more omega-3s in the blood may have a role in asthma management. To the best of their knowledge, this is the first study to show that a lower omega-3 index is associated with poor asthma treatment in asthmatic persons. According to new research, having a higher omega-3 index has a significant impact on asthma management and medication use. 7. Alzheimer's disease and dementia. According to one study, people who eat more seafood may have a lower risk of cognitive decline. There is, however, no evidence that omega-3 supplements can help prevent cognitive impairment or Alzheimer's disease, or that they can alleviate the symptoms of these conditions. In 2015, for example, a substantial NIH-sponsored study revealed that taking EPA and DHA supplements did not postpone cognitive impairment in older people. The participants in the study were all part of a larger eye disease study, and they all had age-related macular degeneration, AMD. Omega-3 fatty acids may have different effects in people with different genetic backgrounds. A 2017 scientific analysis found that persons who have the AP4 gene, which has been linked to an increased risk of Alzheimer's disease, may benefit by taking DHA before symptoms develop. 8. Eye health. DHA, docosahexaenoic acid, a type of omega-3 fatty acid, is a structural component of your retina that is necessary for visual perception. This fatty acid contributes to eye growth and function by signaling and structural effects on retinal photoreceptor cells. Its antioxidant and anti-inflammatory capabilities are thought to be essential for maintaining healthy retinal cells. DHA and its derivatives, on the other hand, have been connected to the pathogenesis of retinal diseases, retinopathies, such as age-related macular degeneration, AMD, and diabetic retinopathy. Another study that identified a link between omega-3 fatty acids and eyesight reported that AMD patients had reduced levels of DHA and EPA, icosapentaenoic acid, another type of omega-3 fatty acid. In a 2020 study, 206 optometrists were polled, and 79% of them said their patients consume omega-3 fatty acids to maintain eye health. 9. Bone and joint. According to research, omega-3 fatty acids help strengthen your bones by increasing the amount of calcium they contain, lowering your risk of osteoporosis. Omega-3 fatty acids have been found to help with inflammatory processes, which means they may help to prevent or alleviate the symptoms of arthritis. Patients who take omega-3 supplements report decreased joint soreness and better grip strength. Arthritis symptoms include swelling and pain in one or more joints. According to a 2020 study, omega-3 fatty acids may benefit arthritis patients with morning stiffness, joint discomfort, and physical function. 10. Inflammation. The body's natural response to infections and injury is inflammation. As a result, it is quite important for your health. However, inflammation can last for a long time even when there is no infection or injury. Chronic, or long-term, inflammation is what this is. Nearly every chronic Western ailment, including heart disease and cancer, has been linked to chronic inflammation. According to a Swedish study, ingesting omega-3 on a regular and long-term basis was associated with a 52% lower risk of developing rheumatoid arthritis. According to a European study, people who ingested the most DHA had a 77% decreased risk of developing ulcerative colitis. Notably, omega-3 fatty acids have the ability to prevent the formation of inflammation-related molecules and compounds such inflammatory eicosanoids and cytokines. Omega-3 fatty acids aid in the reduction of chronic inflammation, which can lead to heart disease, cancer, and a variety of other diseases. 11. Improve sleep. Low omega-3 fatty acid levels have been linked to sleep disturbances in children and obstructive sleep apnea in adults. Low DHA levels have also been linked to lower melatonin levels, which aid in sleep. According to study, omega-3 supplementation increases the length and quality of sleep in both children and adults. In a second study published by the NIH, fatty fish consumption was shown to improve biological activities involved in self-regulation, such as heart rate variability, HRV, implying that omega-3 levels may also affect sleep quality and daily functioning. It also suggests that adequate vitamin D levels and high HRV may be associated with these therapeutic advantages. 12. Skin health. One of the less well-known benefits of omega-3 fatty acids, particularly EPA, is that they may help skin health. Consuming EPA in moderation can keep skin hydrated and reduce the likelihood and severity of acne. In fact, according to a study published in the journal Clinics in Dermatology, omega-3 fatty acids may reduce the risk of premature aging by enhancing skin moisture and reducing oil production. In fact, these fatty acids may hold the secret to successfully treating inflammatory skin conditions. According to research published in the International Journal of Molecular Sciences, combining omega-3 and omega-6 supplements appears to be effective in treating the signs and symptoms of atopic dermatitis, psoriasis, and acne. 2. 6 side effects of omega-3 fatty acids. 1. High blood sugar. Taking a high amount of omega-3 fatty acids may boost blood sugar levels in diabetics, according to certain research. According to one small study, consuming 8 grams of omega-3 fatty acids per day resulted with a 22% increase in blood sugar levels in people with type 2 diabetes during an 8-week period. This is due to the fact that high doses of omega-3s can enhance glucose production, resulting in high long-term blood sugar levels. Other studies, however, have produced contradicting results, demonstrating that only extremely high dosages have an effect on blood sugar. 2. Bleeding. You may be experiencing abnormal bleeding if you experience nosebleeds or bleeding gums after taking omega-3 supplements. One of the potential side effects of omega-3 supplementation is this. In rare cases, fish oil can cause stomach or intestinal bleeding, as well as cause or worsen ulcers. This could be due to the fact that fish oil thins the blood, causing greater bleeding. These serious side effects are more common with high doses of fish oil or when the supplement is used with other drugs. An example from 2014, the study followed a 60-year-old amateur athlete who consumed 20 grams of omega-3 fatty acids daily. Despite having no prior gastrointestinal problems, they developed a bleeding ulcer after adding antibiotics and cortisone to their regimen. Overall, the researchers believe that higher omega-3 dosages are more appropriate for those with heart disease than for people who are healthy. Because of the risk of irregular bleeding, people on blood thinners are recommended not to take omega-3s without first seeing their doctors. 3. Vitamin A toxicity. One of the potential side effects of omega-3 fish oil, particularly cod liver oil, is vitamin A poisoning. Cod liver oil has a number of health benefits, but you should be sure it's good for you and that you don't take too much of it. 1 spoonful of cod liver oil provides around 270% of most people's daily vitamin A needs. Vitamin A is a fat-soluble vitamin. That is, when we ingest an excessive amount of vitamin A, it gets stored in our bodies, mainly in the liver. Vitamin A levels can then rise to dangerously high levels. Excessive vitamin A use, according to the National Institutes of Health, can result in increased intracranial pressure, dizziness, nausea, migraines, skin irritation, joint and bone soreness, coma, and even death. 4. Insomnia. Excess fatty acids have also been linked to insomnia. Some experts believe that omega-3 fatty acids can make it harder to sleep and can affect the quality of your sleep, resulting in an unpredictable sleep pattern. Although, in moderation, taking fatty oils may help you sleep better. 5. Gastrointestinal trouble. Some of the most common side effects of omega-3 supplements are digestive issues such as indigestion, heartburn, diarrhea, nausea, and gas. Other adverse effects you may experience include diarrhea, taste changes, and vomiting, depending on the type of omega-3 fatty acids you take. Vegans who get their omega-3s from algae or flaxseed oil may experience similar negative effects. Indeed, flaxseed oil may increase bowel motions sufficiently to make it a viable constipation treatment. 6. Rash. As with any supplement, you are at risk of experiencing an adverse reaction if you have any known allergies. Skin rashes are not a side effect of fish oil, they are an indicator of an allergy. An allergic reaction to fish oil is identical to an allergy to fish or shellfish. Approximately 40% of those who are allergic to fish or shellfish have their first allergic reaction as adults. Food allergies can begin as a youngster and last a lifetime. If you see any signs of an allergic reaction after taking fish oil, consult your family doctor or an allergist. Keep a food journal to track your symptoms. Keep track of when and how much fish oil you consumed, what you ate, and any side effects. 7. Bad taste or smell. Omega-3 fatty acid side effects may vary depending on where the omega-3s come from in the supplement you take. If you utilize fish oils as your source of omega-3s, you may experience some fishy side effects. Fish breath or a fishy aftertaste can be a side effect of omega-3 krill oil and fish oil supplements. A rotting, low-quality product is typically to blame. While fish oil supplements commonly smell or taste like fish, this flavor and odor should not be retained after consumption. Nonetheless, it is a likely and regular negative impact. Fish and fish oil both have a distinct odor. Some people complain that fish oil has a disagreeable flavor or leaves a bad aftertaste. Others complain it makes their perspiration stink or causes bad breath. Although there is no proof that these adverse effects are lasting, they are the most common ones that people associate with fish oil. 3. Food high in omega-3 fatty acids. It is preferable to receive essential nutrients through meals whenever possible. EPA and DHA are found in animal omega-3 sources, whereas ALA is found in plant sources. Omega-3 fatty acid-rich foods include fish and seafood, salmon, mackerel, tuna, herring, sardines. Nuts and seeds, flaxseed, chia seeds, walnuts. Plant oils, flaxseed oil, soybean oil, canola oil. Fortified foods, eggs, yogurt, milk, milk alternatives, baby formulas. Before concluding, if you like this video, don't forget hit that like button, and subscribe to this channel for more videos like this in the future. Also, be sure to turn on the bell notification so you never miss any of our videos. Omega-3 fatty acids are critical for overall wellness. The best way to ensure adequate omega-3 intake is to consume them in entire meals, such as fatty fish twice a week. Although omega-3 dietary needs differ by country, most governments recommend eating 2 to 3 meals, 200 to 300 grams, of fatty fish per week, 35 grams/d on average, to get 250 milligrams of EPA and DHA per day. If you don't eat a lot of fatty fish, consider taking an omega-3 supplement. This is a low-cost and very successful method for improving health in people who are deficient in omega-3 fatty acids. Surprisingly, since omega-3 became popular, another worry has arisen: oversupplementation. Just as not getting enough omega-3 can be harmful to your health, obtaining too much can be harmful as well, especially to your immune system. As a result, if you're considering taking an omega-3 supplement, such as fish oil, be sure you don't exceed 3 grams per day without first consulting your doctor. So, what do you think about this topic? Let us know what you think in the comments section.